You know, you sent over some really interesting documents this week, government advisories, news reports, all pointing towards a pretty major shift, actually,
Hmm.
in how India is thinking about nutrition, especially for, well, the most vulnerable groups.
Right.
It really got me thinking. Imagine the very programs, designed to help nourish kids, pregnant women, new
Yeah, the
moms.
core support systems.
What if, maybe unintentionally, they were actually contributing to the exact health problems we're trying to fight? That's really the heart of what we're unpacking today, isn't it?
It is. And what's really striking, thinking about those papers, is just the sheer scale of this potential change. You're looking at a huge national initiative, Mission Poshan 2.0,
Right.
making what seems like a fundamental course correction.
Mm.
This advisory from the Ministry of Women and Child Development, dated just April 17th, 2025.
Very recent.
Very. It essentially says, look, no more refined sugar. No more of those high-fat, high-salt, high-sugar foods, the HFSS stuff,
Okay.
in the supplementary nutrition they provide. It's a pretty bold move.
It absolutely is. And for everyone listening, joining us for this deep dive, the mission today is really to get our heads around this sweet revolution, as some people are calling it. We want to explore, why this fairly dramatic change. What exactly is the government telling states to do now? What roadblocks might they hit? And ultimately, what could this really mean for the health of millions across India long term? Think of this as like getting the inside track on a major national health strategy.
And we're drawing directly from those government directives and the expert commentary that's been in the news.
Exactly, the primary sources.
And if you step back and look at the bigger picture from what you've shared, it really highlights this growing understanding, maybe at the highest
I
levels.
always think so.
Yeah, about how deeply diet and overall health are linked, especially for those groups most at risk, from nutritional gaps and, crucially, the early start of non-communicable diseases.
So let's dig into that. What did things look like before this advisory? What was actually going on with those nutrition kits that made them say, okay, stop?
Well, based on the information you've pulled together,
Yeah.
it seems the ministry, after what sounds like a pretty critical review,
Mm-hmm.
found a worrying pattern.
Mm-hmm.
These take-home rations, the THR, and the hot-cooked meals, HCM,
The main delivery methods.
right, intended to provide essential nutrition, but often they were actually quite high in refined sugar. They also had a lot of salty processed snacks and just too much unhealthy fat.
It really paints a picture, doesn't it? Like a well-meaning effort that somehow just lost its way a bit.
Yeah,
Someone used an analogy like being given a lifeboat but's got a hole in it.
that's a good one.
The help is there, the intention's good, but it's not solving the core problem, maybe even making things worse.
That sums it up pretty well. And the advisory itself, the one you shared, it's quite direct about it. The ministry isn't just suggesting, let's cut back a bit on these HFSS foods.
Mm-hmm.
No, they're calling them out as a serious problem, needing active removal. And the absolute core of it is that outright ban on refined sugar.
Completely out.
Completely out. Now, sweetness isn't totally banned, but the only sweetener allowed now is Jaggery.
Okay, Jaggery, like the traditional unrefined sugar.
Exactly. And even that has a really strict limit, has to be less than 5% of the total energy in the food.
Wow, okay. Less than 5%. That's quite specific.
It is. It shows they're serious about minimizing added sugars overall.
And reading through the documents, it also felt like there's a real skepticism about pre-packaged, ready-to-eat type foods.
Yes,
Ah.
definitely.
Yeah.
The advisory expresses, let's say, a general discomfort with them.
Mm-hmm.
It raises concerns about things like preservatives, artificial colors, artificial flavors.
The usual suspects in processed foods.
Right. The things that often come with that kind of packaging, there's this clear underlying preference for food that's, closer to how you'd make it in a kitchen
Right.
rather than something formulated in a lab,
Yeah.
really emphasizing whole, minimally processed ingredients.
Wow. Okay, so we've got this issue, identified too much sugar, unhealthy fats, sneaking into these vital programs. But stepping back for the listener, why does this matter so much? What are the actual health consequences we're talking about?
Yeah, this is where it gets really serious, the public health side of it. India, as we know, is grappling with a growing crisis of non-communicable diseases, NCDs.
Things like diabetes, heart disease.
Exactly. And what's particularly alarming, and what these reports really underscore, is that we're seeing these conditions, obesity, diabetes, heart problems, showing up more and more even in young children and in pregnant women.
That early. Wow.
Yes, that early, consistent exposure to these less healthy diets can just set them on a really difficult health path for life. It is long-lasting, serious effects.
It's that idea of like laying down the foundations early on, isn't it? What we eat, especially during those critical growth phases, pregnancy, it just has such a massive impact down the line.
Precisely. And this advisory, the one you've highlighted, it lines up perfectly with recommendations from, say, the World Health Organization.
The WHO, right.
And also the official dietary guidelines for Indians. Both have been pointing out for ages the harm HFSS foods can do. We know they contribute to unhealthy weight gain, they cause big spikes in blood sugar.
Which is terrible for diabetes risk.
Absolutely.
Yeah.
And they're bad for heart health, too. It's a whole package of negative effects.
One of the news reports you included had a quote from Dr. Arun Gupta. He's a pediatrician and convener of Nutrition Advocacy in Public Interest, or NAP.
Ah, yes, Dr. Gupta, a well-known advocate.
He called this advisory long overdue, and he stressed its potential, saying it could protect millions from these diet-related NCDs. That really hits home the scale of the potential impact.
It really does. And Dr. Gupta also brought up a really important next step for us to think about.
Oh, what's that?
He mentioned the need for a clear, really solid definition of exactly what counts as HFSS in maybe a follow-up advisory.
So nailing down the specifics.
Exactly.
Yeah.
Because high can be subjective. And he also argued strongly for a complete ban on prepackaged foods, specifically for the youngest groups, infants, young children, adolescents. He sees them as particularly vulnerable.
Okay. That makes sense. So let's get into the real nitty-gritty of this advisory then. For you listening, what are the key things that states and union territories across India are now actually being told to do?
Right. The directive from the WCD Ministry, based on these documents, it breaks down into several key actions. First, as we said, the total ban on refined sugar in both the take-home rations and the hot-cooked meals.
Gone.
Gone. The only sweetener allowed is Jaggery, and again, that strict cap, under 5% of total energy.
That Jaggery point is interesting. It sort of nods to cultural tastes, maybe, while still pushing for health.
I think that's a good way to put it.
Yeah.
Second, the advisory explicitly bans HFSS foods, making sure it aligns with those WHO and Indian dietary guidelines we mentioned.
Okay.
Third, it really pushes for using salt sparingly. It even suggests trying recipes with no added salt or sugar at all.
Only no added salt.
Yeah, the idea being that the people receiving the food can then add salt or seasoning themselves if they want, based on their own needs or taste.
That's quite a shift. Giving people more control, in a way.
It is. It moves away from a sort of one-size-fits-all approach to seasoning.
Okay, what else?
Fourth, a clear blacklisting of preservatives, artificial colors, and artificial flavors. Again, reinforcing that focus on natural, whole foods.
Right.
And finally, it strongly urges states to cut down sugar substantially in things like morning snacks and the hot-cooked meals, really pushing for recipes where the nutrition is the priority, not just making it sweet.
And it's crucial to remember, as these reports stress, this isn't just a suggestion for a few places. It applies everywhere, right? To everyone under Mission Poshan 2.0.
Absolutely. That's what makes it so significant. It has this massive reach across the entire country.
It really sounds like a very thorough overhaul. You mentioned earlier, though, this wasn't just a snap decision made last week. There was advocacy involved.
Oh, absolutely not sudden. This is really the outcome of years, probably, of sustained effort by lots of people. Nutrition experts, pediatricians, public health advocates, they've been consistently raising red flags about the quality of the food in these programs. The articles mention individuals like Neelmani Singh, a public health nutrition expert, who has apparently been in direct communication with the WCD Ministry about this, really highlighting the risks of added sugar. He's quoted as being very pleased with the advisory.
Just for him.
Yeah, he emphasized the long game, protecting kids from chronic diseases later in life, and helping them actually enjoy healthy food.
It's really heartening, actually, to hear about people working behind the scenes like that, pushing for these kinds of changes.
It is. And we definitely need to acknowledge the major role of Dr. Arun Gupta and his organization, NAPI. They've been very prominent critics of HFSS foods for a long time.
So, consistent pressure.
Very consistent. Their advocacy, always backed by evidence, has undoubtedly played a huge part in getting this policy shifted. They've just been relentless with the message that these vulnerable groups deserve the best nutrition possible, not stuff that could actually harm them.
You know, it's almost, well, it's been ironic when you step back and think about it.
How so?
Well, these programs, set up with the absolute best intention to nourish people, might have been completely inadvertently feeding into health problems. It's like that, that friend who means well but always gives you terrible advice.
Yeah, there's definitely an irony there. And looking at the specifics like that Jaggery only rule, the 5% limit,
Yeah.
it does make you think about the practical side.
Like recipe development.
Exactly. How do you make things tasty and appealing, especially for kids, without relying on that easy hit of sweetness? And the ministry's clear pushback against prepackaged foods. It really speaks to a wider worry about marketing claims versus actual nutritional reality.
So, looking at the bigger picture then, for everyone listening, what's the potential long-term payoff if this policy shift really takes hold?
Well, and it's an important if this advisory is implemented effectively across the board, the reports suggest it could genuinely contribute to a much healthier future for India.
How so?
By actively working to slash the intake of refined sugar and those HFSS foods, among these really key population groups, the government's taking a really proactive stance against that rising tide of diet-related NCDs.
Right.
This could potentially help break that cycle, poor nutrition leading to poor health outcomes later in life.
It feels like a real investment in preventative health, doesn't it? Instead of just managing the problems once they arrive.
That's exactly it. And the hope, which comes through in these sources, is that it might also spark a wider cultural shift, maybe towards valuing simpler home-cooked style meals again, and empowering families, giving them the confidence to make better food choices overall. When kids get consistently healthier options through these big programs, it can actually shape their tastes and habits for life.
That sounds incredibly positive. But let's be realistic, too. Rolling something like this out across a country as huge and diverse as India, there must be some major challenges, right?
Absolutely. You're spot on. The documents you shared definitely flag several potential hurdles. First off, logistics.
Supply chains.
Exactly. Getting a reliable, consistent supply of good quality Jaggery, fresh ingredients, unprocessed stuff across the whole country at the scale needed. That's a massive logistical puzzle.
I can imagine.
Then there's taste. Let's face it, moving away from sugary, salty foods.
Yeah.
But there might be some initial pushback.
Kids might not like it at first.
Or even adults used to a certain taste. So states will need to get creative, develop recipes that are healthy and genuinely appealing. That takes effort and skill.
And probably money.
That's the next point. Budget constraints. Healthier, whole ingredients can sometimes be more expensive than the refined, processed options they might replace. So careful budgeting and resource allocation will be key.
Okay. Supply, taste, cost, anything else.
And the big one, compliance and monitoring. Making sure all the states and union territories actually follow these guidelines consistently. That requires robust monitoring systems. It's easy to issue an advisory. Making sure it happens on the ground is the real test.
So yeah, the intention is clearly there, and it's a great intention, but the actual follow-through, the implementation, that's going to be absolutely critical.
It is. It's a really hopeful step, definitely, but it's one that's going to need sustained political will, dedicated resources, and probably quite a bit of public support, too.
These challenges sound significant, but hopefully, as you say, not impossible.
Exactly. With the right commitment, they should be surmountable.
This really does feel like a pivotal moment, though, this decision to really focus on the health of vulnerable groups by tackling something so, well, pervasive as sugar in these huge nutrition programs. It feels like a genuinely significant and bold step.
It really makes you pause and think, doesn't it?
Yeah.
About the ripple effects policy changes like this can have.
Yeah.
Not just on individual health, but potentially on the whole country's well-being and even productivity down the line.
It definitely leaves you wondering about those long-term effects. If this is successful, if it sticks, what kind of India might we see in terms of public health and eating habits, say, 10, 20 years from now?
Yeah.
And maybe the bigger question is, how do you make sure these positive changes aren't just temporary? How do they get embedded for the long haul? It's certainly something to mull over.
It really raises that crucial question for all of us to consider. How do we ensure these kinds of positive shifts become deeply ingrained, sustainable parts of our food systems, and just our normal dietary habits?
Well, thank you for diving deep with me into this. It's a really important development, and it's certainly given me, and hopefully everyone listening, a lot to think about regarding the future of nutrition in India.
It's been a really vital discussion, I agree. Shedding light on what could be a truly significant shift in how the country approaches nourishing its people, especially those who need it most.
And thank you all for joining us on this deep dive. We hope this has given you a much clearer understanding of this sweet revolution and what it might mean for the health of millions. Until our next deep dive.